Hi everyone, we are going to show you today how to do Trach Care. Okay, so I come into the room, introduce myself, I wash my hands, I provide for privacy by closing the door and the blinds, I explain the procedure, and then I get started, okay? So I already gathered my supplies. I have a Trach Care tray or kit here, and I have a bottle of saline. It's opened already, so in that case I would have to look at the date and time and the initials, and if it wasn't opened already and I'm opening a new one, then I would put my date, time, and initials on it. This we're going to pretend like is our peroxide solution, okay? And it would be the same way, date, time, and initials. So when I open my tray, I'm going to open it away from myself. You might want to leave the flap on because you'll be using it several times. Okay. So I'm going to remove my sterile field here, and I'm going to do it in the way that I can see that the shiny side is facing up, so that's the part that's going to go down. But you should have like a little corner on yours that you'll be able to pull it out easier. So we'll take it out, and remember you can only touch the 1-inch border. Down, only touching your 1-inch border. Okay. And then I'm going to go ahead and remove my gloves without contaminating my tray. And then I'm going to dump all my supplies onto my field. If anything rolls off your field or within your 1-inch border, this is really close right here, but it's okay. If it rolls off or into your 1-inch border, then you need to get rid of those supplies and ask for new supplies, okay? So I'm gonna try to set up my field in a way that is best to where I don't have to cross over anything. So I'm going to pour my solutions next, and you can move your table around a little bit too. So the first one, this large opening here is going to be, and so that needs to be actually closest to me because it needs, I don't want to cross over anything. That's going to be a mixture of half and half saline and peroxide. So I'm going to pour my saline into my compartment here with my hand over the label. Same with these two spots, put saline in them, okay? Next I'll take my peroxide and pour 50% peroxide in that area. And then I'm done with my solutions. Next, I would have clean gloves on, so let me grab some gloves because we forgot to do that. Got gloves, so obviously I would not have left my sterile field or turned my back on it, but I should have had gloves with me. So the patient's going to have an oxygen source, a trach collar, or a ventilator hooked to his trach. Right now he doesn't. And you also want to position yourself on the side of the bed where your dominant hand is going to be doing all the work, okay? So he would also have a trach dressing that you would remove and throw away. And then you would remove the trach inner cannula, okay? And honestly, the best way to do that with these mannequins is to remove the pillow. That just gives you a little bit more room to work. So I'm going to set his pillow back here. We'll just remember to give his pillow back. So we're going to remove it by coming down to the 6 o'clock. You always want to hold pressure on your outer cannula as well. And then turning towards yourself. So for me, it would be 3 o'clock. Okay. And then I'm going to drop it into my solution, like that. If there was solution in the compartment, it's not going to bounce out, right? So it's going to stay right there. I'm going to remove my gloves and throw them away. And then I'm going to put on my sterile gloves. It's kind of hard to fit everything on these little trays, but I like to come around the end here and put my gloves on right here on the end. Dominant hand first. Tuck the second one. Just like that, okay? You can get rid of this or you can use it as an extension of your sterile field as well. So now we're going to set up our sterile field in the order that makes the most sense for us, to where we don't have to cross over anything while we're working, okay? So the trach dressing and the trach ties are the last thing that we do, so I'm gonna put it furthest over here. I'm gonna use gauze at a couple different places, so I'm gonna spread that out. The brush is the first thing that we're gonna use. Then we're gonna dry the inner cannula. Then we're going to clean the outside. These get kind of stuck together sometimes. Clean the outside with our Q-tips. Put them to where I can grab them easily. We're gonna dry and then we're gonna change our dressing and our trach ties. So that's the order of that of which we're gonna use our supplies, okay? So first thing I'm gonna do is I'm gonna take the inner cannula here and I'm going to take my brush and I'm going to clean the inside. I always do the inside first and then I do the outside, then I do around the edge here because it might be the dirtiest. The point of this is to make sure that you're not introducing any new contaminants to your patient. So the germs that they already have on them is it's their own. So it's not as big of a deal as, say, if I were to touch the bed and introduce that into his airway. This section here is only saline, so I'm going to drop it in there, let it soak to rinse off all the peroxide. I'm going to get rid of my brush. Okay. Then I'm going to pick it up. And I like to dry the outside first just to get a lot of big drips off. Dry it. And then you'll use your Q-tips to dry the inside. Just like that. Okay. Next, we are going to put the inner cannula back into the patient, okay? So we're going to do this in a way that we maintain sterility as best as we can. So we're going to start at the 3 o'clock position again, and then twist to the 6 o'clock, lock it in place. Make sure that you get it locked in place. This one, as you can see, it clicks in. You can pinch the wings here to do it a little bit easier, gentler on the patient. But make sure that it gets locked in, because if it's not, then a big cough can make that go flying across the room. So make sure that that's in. Next, what we're gonna do is use our Q-tips to clean the outside around the trach area. So we're gonna use the compartment that we have not used yet, and it's only saline. Dip it, and there's a few different ways that you can do this. Sterile technique is to go away from yourself. But we also know that there's an incision underneath this, so you want to go away from the incision as well. So the way I typically do it is I start close to myself and wipe away at the top, discard, wipe away at the bottom and discard. Then I'm going to, over the top of the base plate here, you're going to wipe away from yourself, and then away from yourself again. And then you have one more just in case it's extra dirty, and honestly you're going to end up using more Q-tips than you have, because this is going to be probably the dirtiest area, so you can wipe it off here. Another way to do it is to start in the middle and go away, get a new Q-tip, start in the middle, go away, get a new Q-tip, middle, go away, and then around the base plate. Either way is okay, as long as you're not going towards towards yourself or towards the incision and dragging germs into it. So now it's wet with saline, so we want to dry it off. We'll just dab it. Okay, toss that. And the order of which you do this doesn't really matter. You can do the trach gauze sponge here first, or you can do the ties. I like to do the ties first. And this one is conveniently already untied for us. So I'm going to remove this one just because it honestly wasn't doing much good anyway, but you probably are going to want to put the new trach ties on first before you take the old ones off. If I were to remove this first, that's okay, but again, a big cough can make the entire thing come out, so you need to just keep your hand here to stabilize it. So you're going to feed this in through here, like that. You don't want a lot of wrinkles because it can cause skin breakdown. Nice and straight with your ties. It's kind of hard to get them even. Okay. Go around. You're going to go back through like this. And then you're going to tie it in a double knot. If the ends of the ties are bothersome to the patient, you can trim them, but make sure that you're leaving enough to for the next person to get it done, to get it undone. You want to check and make sure that you can fit 2 fingers underneath it so it's not too tight. The tie or the knot should either be up against the base plate or in the back. It should not be over any of the major vessels in the neck, like the jugulars or the carotid. So it needs to be there. And then finally, you'll replace your gauze sponge. So at this point, my hands aren't sterile anymore, if you haven't noticed. But I just try not to touch that gap in between. I'm going to slip it underneath here. The opening goes to the top. Like that, just to catch any secretions. You're going to replace his oxygen at any point during the procedure if he needs it. A lot of times I like to have the trach mask pointing towards the opening, even whenever the inner cannula is not in there. And you obviously would never do this procedure if he was struggling to breathe at all, or if he was needing to be suctioned. So you would do the trach suctioning first. Before you did trach care, so he needs to be completely stable. And then I usually like to give the patient, like, if he raises his hand or waves his hand, then I know that he's struggling and I need to stop what I'm doing. At this point, I would clean up my supplies and throw all of this stuff away. I would remove my gloves, and I would lower the bed to the lowest position, put the side rails up, give him his call light, and leave the room.